With the current military presence in Los Angeles really deeply impacting our community, I felt it necessary to speak to how this is impacting public health in real time. I'm Justine. I'm CEO of Action for Resilience Climate and Health Collaborative. I'm also a fourth-year medical student in Los Angeles. On Sunday, June 8th, thousands of National Guard officers arrived in Los Angeles to subdue protests over ICE raids. The following day, at the hospital where I rotate, which is the largest single healthcare provider in LA County, we had patients specifically calling to cancel their appointments because they stated that they were too scared to go outside due to the military presence. And one of my colleagues' morning clinics that day was completely empty. And we know that for our patients, many of these visits are scheduled months in advance, and they require tons of coordination, from getting time off work, getting childcare, coordinating transportation, all to arrive at a single clinic visit. And if our patients are too scared to go to their healthcare appointments, how much less likely are they to engage in preventative health behaviors, to feel safe to go for a run in the park, to get groceries, to participate in public life and see their neighbors, all things that are incredibly important for public health and for community resilience. And to give just one example of this, a community event the Arch Collaborative was going to take part in order to provide extreme heat supply kits as well as educational resources has now been postponed due to the ongoing military presence. And on a personal level, as an LA resident myself, now we have curfews, we have police sirens, and we have helicopters buzzing at all times of day and night. And I can experience and see firsthand how that increases allostatic load, increases stress hormones that we know have detrimental impacts on our health. Overall, we have seen that the presence of thousands of National Guard officers and hundreds of U.S. Marines has not made Angelenos feel safer, and instead has stoked more outrage and fear at the injustices done by the current administration. We need to remember that the show of force is not merely political, but affects real people and their health. We will not give up on fighting for the right to health care, and we will not give up on fighting for our communities to feel safe, healthy, and resilient. I'll include some resources on our link tree in case you're interested. Stay safe, everyone.